Even with the government shutdown looming, a key part of the Affordable Care Act is set to get underway tomorrow. And beyond the debate, there are plenty of questions. CBS News business analyst Jill Schlesinger joins us now. Jill, good morning.
Good morning.
So tell us what it means.
Well, let me tell you who doesn't have to worry about this. If you have insurance through your employer, if you're on Medicare, if you're on Medicaid, if your child is covered by CHIP, if you're on COBRA, relax, deep breath. You don't have to do anything. You are covered. What we are talking about tomorrow is for uninsured legal citizens of the U.S. They can start shopping for health care coverage as of tomorrow at healthcare.gov.
So people who can start shopping tomorrow, where will they be able to find information about where to buy insurance and how much will it cost?
Okay, it's very confusing, but it really isn't, okay? So what you need to know is if you go onto one of these marketplaces at healthcare.gov, you are going to be led to a question that says, where do you live? Because each state has something different. When you get there, you're going to see different types of coverage for each, say like covering 60 to 90% of your healthcare costs. You can choose it. Remember, this
there's
is
a
like,
gold plan, there's a platinum plan.
Right, and all the precious metals plans. And you know what's interesting is this is really like going to shop for a flight on Travelocity. You're going to a place, you're comparing costs, you're choosing coverage. That's what you need to know. This is all starting tomorrow.
But Jill, you make it sound so easy. There have been so many reports of glitches already.
Well, I think that any rollout of a website and a huge initiative, there are going to be glitches. But the concept should be easy. You can start shopping on October 1st for coverage that begins on January 1st. And like any open enrollment, you actually have a longer period of time. So from October 1st all the way through March 31st, you have a chance to get coverage. Again, if you don't have insurance. If you have insurance, you don't have to do anything.
There's a lot of examples of how much it costs, but the penalty, if you don't buy, if you're an individual, let's say you're young, you're healthy, it may cost several $100s a month, or you get to pay, what's the penalty, $95 a year? Yeah. Won't a lot of people end up just paying the penalty?
Well, remember, the penalty is $95 a year or 1% of your income, whichever is greater. That's for next year. The cost goes up in the next couple of years. So when we get to the year 2016, it's $695 per person or 2.5% of your income. That's a real incentive. Look, this plan has to get young, healthy people in it, or else the math does not work.
And if there's a government shutdown?
We're open for business at the Affordable Care Act. The reason is that this is a funded program. So everything will work tomorrow, hopefully as planned. Yes, there will be technical glitches, but everyone, this will work out all right. Don't worry.
Thanks, Jill.
Thanks, Jill.